This is Kai Smith, your certified trichologist. I am also a licensed cosmetologist for 25 years. I help women uncover the unknown factors about their hair loss. And I also help my colleagues identify hair loss behind the chair. So I love what I do. And I'm just thankful that I'm able to come to this platform and share my passion for trichology with you guys. And so yesterday we talked about just the psychological effects. Hi, Dr. Lisa. We talked about the psychological effects of hair loss yesterday. And so my biggest thing with that is it really femininity or is it vanity? And you know, it's a controversial subject, so some people say that it's vanity. That is typically the answer of someone who has never suffered from hair loss. My opinion, because I am a sufferer of hair loss who has overcome, is that it is femininity, because we're not thinking about being vain, we're thinking about our dignity being taken. We're thinking about being robbed of our sexy, all of those things that are near and dear to us as a female. So that's kind of what we talked about yesterday, because I think that the psychological toll that hair loss has on a woman, it is downplayed, and most people think that you're being vain. Relationships are in shambles because people are not empathetic. They cannot relate to you when you're talking about your hair coming out. And the first thing that they'll say is, well, you don't need hair for life. You're still living, so you should be excited that you're living. But if you've never experienced hair loss, once again, that will be your answer to someone who is complaining about losing their hair, or they're saddened, or they become a recluse. Their life has definitely been changed. Their overall emotional well-being has been shaken because of their hair loss. So those are the things that we talked about yesterday as it pertains to hair loss. So as you guys are coming in and joining me, and even you guys that are joining me on the replay, I just ask that you share this on your platforms, because this is something that I'm very passionate about. I'm very passionate about educating women about hair loss. I'm very passionate about educating my colleagues about hair loss, because it's something that is serious. Because hair loss is a barometer, I'm sorry, not hair loss, but our hair, our skin and our nails is actually a barometer of our health. So it's connected to something much deeper. So I'm very passionate about sharing this information. So if you would do me a favor and share it on your platforms, I greatly appreciate it. So today we are going to be talking about the lackadaisical approach. The lackadaisical approach, or support from the medical industry. If you guys have ever experienced hair loss, have you ever experienced hair loss and your initial response be to just run out and buy something really quick from the store? You go to the beauty supply, or you go online really quick and you try to figure out what you can do to stop your hair loss. So you purchase this product, or if that one doesn't work, you purchase another product, and you find yourself in a vicious cycle of purchasing products that are not working. Typically, that's usually your first response, right? That's typically the first response to a woman who has her initial onset of hair loss. She'll run out and she'll buy something thinking that it's going to be easily solved, that she can fix her problem really quickly. And then it persists for however long, because typically the woman that I see in my office is someone who's probably been experiencing hair loss for 5 years or more. Don't get me wrong, I do see women in my salon that have only been experiencing hair loss for maybe less than a year, but in general, this has been an uphill battle with the women that I see and I get the chance to serve and support. It's been an uphill battle with them trying to figure out what's going on with them as far as their hair loss is concerned. So the initial onset, they ran out and they bought something just to see if they can get it to stop. But when that didn't work, they continued on with the vicious cycle of purchasing products that just did not work, right? And so when that didn't work, then maybe your next step was to go out and seek professional help from your primary care physician and or a dermatologist, because maybe you just have the kind of insurance that allows you to just jump straight in to go see a dermatologist, or maybe you have to get a referral and you have to go through the process and you go and see your primary care physician first. And when you go in to see them, Did they tell you something like, oh, well, everything is okay, or you just have alopecia, or your hair is just over processed, stop using chemicals in your hair, and everything will be fine? Do those things sound kind of familiar? If I'm talking to you guys that have ever experienced hair loss, where you've been given kind of like the runaround, and after you leave, a co-payment later or a prescription later, your hair loss is still persisting. You stopped that relaxer. You stopped, with the ill hair care practices that they've told you about that were causing your hair loss, or you've used the prescription that they've given you, yet to no avail. Your hair is still coming out. Nothing has changed. Is that you? Has that been any of you guys' experience where you've done the things that you've been told to do, and yet your hair is still coming out? And then maybe the dermatologist told you that you had alopecia, but that was all they told you, that you have alopecia. Well, if they just tell you you have alopecia, that's just like telling you hair loss in a different language. Alopecia just means hair loss in Greek. And so I'm asking you these questions because these are the things that my clients come to me and say, well, I've sought professional help and they just told me I have alopecia. They didn't tell me what. They just gave me this prescription, but they didn't tell me why I was using it. It made my hair feel this way. I feel like it made my hair come out more, when I started using this treatment. They didn't really tell me anything. They didn't give me the support that I was looking for. So here you are, a co-payment later, more confused than you were when you went into their office, because they never gave you specifics about what was happening to you. I hear it all the time, and quite frankly, I experienced it as well. I spoke about my personal experience with hair loss yesterday. And so it can be quite frustrating. We look to our doctors as being the ones that know everything. When something is going wrong with us and we've been on Google and we can't seem to self-diagnose or whatever's going on, we look to them to give us all of the answers. But when you go to them and you get empty, or answers, as I will call them, they're empty because they're roundabout answers. They're not really answering you directly, so to speak. It's a roundabout answer. You're really not getting the support that you need from that doctor or that dermatologist, because you're leaving there the way that you came, with unanswered questions. And it's frustrating. Personally, it was frustrating to me, and to my clients, it's just as frustrating. And so with that, I consider that to be lackadaisical support, because they'll tell you that, your hair loss is no big thing. Oh, you can live without hair. Oh, just get over it. These are some of the things that my clients have been told by a medical professional that is supposed to be there to serve and support us in a time of need when we need medical attention. And because they downplay hair loss, they're not willing to go on a wild goose chase to figure out what's going on, because quite frankly, they don't know where to start. They don't know where to start. Not all hair loss is caused because you have an imbalance going on in your body. It's not all caused because you have an imbalance in your body. There are some certain forms of hair loss that, traction is one of them, where, that's self-inflicted. So it doesn't mean that you have something going on in your body. But for the most part, there are imbalances occurring inside of your body that is causing this hair loss. It is your body communicating a language that something is going awry in your body. Does it have to be deathly wrong? No. But can it be a minor imbalance? Yes. Why? Because your hair is a non-essential tissue. Very, very sensitive. So if you are experiencing hair loss and you've been to your doctor and your doctor has told you that everything is okay, but yet and still, you still feel like on the inside, like your gut is telling you on the inside, like something is wrong. Like, I don't just want to take that for an answer. Something is wrong. Don't feel like you're crazy. Do not feel like you're crazy because you feel like something more is wrong, but you've been told by different doctors on separate occasions that nothing is wrong with you. If you feel like something is wrong, that is your intuition. Do not let anybody deter you from figuring out what is going on with you, because if there is some hair loss going on, there is some, and you're not self-inflicting, there is something going on with you. There is something going on with you that you need to get to the root of. And I don't care what medical professional tells you otherwise. There is something going on with you, because hair's natural course of action is to grow. Your hair's natural course of action is to grow. The only way your growth cycle is interrupted is when there's something metabolically off that is causing a shift for your hair to prematurely shift into the telogen phase, which is your shedding phase. Now, could it be something very minute that is off? Yes. Or could it be something major that is going on with you? Yes. But your body is communicating to you that something is going on. So if you have hair loss, and hear me, if you don't take anything else away from this masterclass session today, if you have hair loss, and you've been on an uphill journey trying to figure it out, and you've exhausted countless dollars on products, and you've seen several doctors who have not had answers for you about your hair loss, that doesn't mean that you're crazy. That just means that they haven't taken the time with you to do the proper diagnostic testing to figure out what's going on with you, because there is a name for what's going on with you. And your hair loss is just a symptom to something else greater that is happening within your body. So do not take no for an answer. And so that leads me to say, once again, have you had blood work done? Have you had blood work done that the doctor has told you, oh, your blood work is fine. Nothing is going on with you. Everything is fine with you. Has that been you? Has that been you? I like to just say this, because as a trichologist, we typically deal from a naturopathic perspective. So we will always be on the other end of the scope when you speak about Western medicine. We will always speak a different language than the conventional medicine person. We will always speak a different language, because we do things from a naturopathic perspective. We do things from a healing, a self-healing perspective. We do not give you medicines to simulate the body's functions. We deal with natural healing. And so when you speak to a naturopathic doctor or you speak to a trichologist, the language is going to be very different from one who is practicing Western medicine or conventional medicine. And naturopathics and trichologists look at optimal reference ranges when it comes to blood work. We look at optimal reference ranges, whereas your conventional or Western medicine doctor is going to look at normal reference ranges. There has been research done on optimal versus normal, and typically where optimal comes from, the optimal perspective is a more proactive perspective, is more preventative care, because when you're looking at reference ranges, if it's off just one little hair of a decimal, when you look at an optimal reference range, then your naturopathic physician is going to start working with you to get you in alignment. Because even if you're off a hair of a decimal with your blood work, when you're looking at optimal ranges, your body is definitely going to be showing some type of symptoms. Whether you know what those symptoms are, whether you're feeling them, or whether you've noticed them or not, your body will definitely start changing and shifting, because there is a shift in your blood levels. And so when that happens, eventually after a period of time that this is happening to you, and those blood levels continue to get more out of optimal range, that's when your body starts talking to you and telling you that something is wrong. That's when that hair loss starts occurring, saying there's a deficit somewhere in the body. Because once again, your hair is a non-essential tissue. If there is anything going on in your body elsewhere, your body knows fight or flight. If you've been listening to me, you know I say this all the time. Your body will go and extract nutrients from your hair cells and distribute them to the body systems that are in need, that are in a deficit, in order for your body to survive. If you notice, I say survive, not thrive, because your body isn't thriving at that point. It's just merely surviving because it's extracting nutrients from somewhere else so that it can be replenished within that body system. And so with that, when your optimal results, when you're looking for at an optimal perspective, you're going to notice these things, and your naturopathic will get these things back into alignment for you before you even notice anything going on. And that is called being in tune with your body. And some of us are so out of tune with our bodies that our bodies have just stopped even speaking to us and telling us when something is wrong, because it has become the norm for our body to operate in that state. Okay? And so when you're looking at a normal reference range, it's typically looking at a reference range for someone who is pre-disease or disease, already has that disease. Because when scientists, doctors, whomever go in to do their research, they're looking at numbers for causing disease. They're looking at reference ranges typically in a state where it's causing a disease. So they have pre-disease numbers, and then the numbers when your body actually has that disease, whatever it is. And so with that, you're already pre-diabetic, hypertension, whatever the situation may be, you're already when they use these normal reference ranges. I don't know about you, I don't want to be compared to somebody who is borderline ill or already ill when they serve me up a reference range for my blood work. And then they tell me, oh, you're perfectly fine, nothing is going on with you, but you still feel ill. You can still feel your body is off. And this is one of the reasons why when you go to your physician and you're telling them how you feel, and then you get this blood work back and they say, oh, you're perfectly healthy, nothing is going on, because they're basing it off of a normal reference range, not an optimal reference range. And so you need to be really clear about where you stand as far as your health is concerned and what ranges are being viewed when you're having your blood work done. And so this is typically why when someone comes to me with hair loss and they tell me, oh no, Kai, I've already had my ferritin check, my iron check, my vitamin D levels, they tell me that they're fine. And I say, well, this is a part of the process. When you come and you work with me, I want to go ahead and I want to check these things to see where they are. And when I get those numbers, they are so far below standard. I had one person that was so far below the ferritin standard, I don't even know how she was walking around, but the doctor was telling her that she was okay. Because the blood work that we look at, we're looking at it for a reference range for your hair to survive, for your hair to still get nutrients. They are only looking for your body to survive. And for your hair to survive and for your body to survive, those are two different numbers. Optimal versus normal. And so with that, you have to know exactly what's going on with you almost so that you can go in there and communicate with your doctor effectively, because typically we do the reverse. We go in there and we wait for them to tell us what's going on with us. But the first thing they do is say, what symptoms do you have? And I've had situations where they never even did any diagnostic testing on me before they wrote me a prescription based on a symptom that I said that I had. And so what are we doing? We're treating symptoms, or are we looking for the underlying problem here? Because you can silence a symptom, yet and still the root is still growing like wildfire. So what kind of medicine are we really practicing when we practice from that perspective? Because as you know, medications have their own side effects as well. So you go in there with one issue, you start taking medicine, and then you get another issue from the medicine that you're taking, and it's a vicious cycle. And so when you work with me as it relates to your hair loss, I'm definitely going in and I'm looking for things that are not so obvious. Because rather than spending 10 minutes with you in the room that you have with your doctor, I'm spending 60 to 75 minutes with you, because I'm on a fact-finding mission trying to look for the not so obvious. The not so obvious. And when I do that, I'm able to make discoveries that your doctor cannot make, because I'm looking for specific things based on what I extract from you. I'm having blood work done based on what I extract from you. And don't get me wrong, as a trichologist, I'm not a phlebotomist and I am not authorized to take blood. But I do partner with other healthcare professionals so that I can get the support I need in order to get to the root cause of my client's hair loss. So with that, this is how I'm able to help my clients uncover what's going on with them, because I'm on a fact-finding mission. I'm using diagnostic testing to bring me conclusive evidence to support treatment. So I'm actually treating the root, bringing what's out of balance into balance instead of treating symptoms and then have you running like a hamster in a wheel. I'm treating the actual symptom, and I'm using our healthcare providers to do it. Why? Because I'm educated on hair loss, the different causes of hair loss. And based on the 60 to 75 minute consultation, I extract certain information from you that is going to actually help support me, support you. I actually have information to help me support you, meaning when you go in to see your provider, whether it's a specialist, a primary care physician, or you're a specialist, a dermatologist, an endocrinologist, whoever it may be, I've already educated you about what's going on with you. We just need to use their credentials to confirm what's going on. You already know what it is, but we need them to confirm so that we can move forward in your healing process. And so with that, because you become educated, because I've coached you on everything that you need to know about your situation, and I've actually typed a script for you so that when you go into their office, you have the support that you need. You have the rebuttals. If the doctor says this, you already know how to go in there and take a stance and fight for your position so you can get what it is that you need when you leave there. And you will no longer leave the doctor's office a co-payment later with unanswered questions, because Kai has supported you all the way to the end. So this is why I am so passionate, because I've had the lackadaisical support in the doctor's office. I've had the lackadaisical support. And so I know how that feels. And so it allows me to get in the trenches with my clients and educate them on the things that they need to feel supported when they go into the doctor's office. Because see, as a woman with hair loss, the one thing that we don't feel is support. We don't feel support from our friends, our loved ones, our medical professionals. We feel like nobody understands what we are going through. And so that is my job, to educate and support you through the process. So that's why I call myself a hair loss advocate, because I know how it feels to lack the support. And I know how it feels to feel like someone in the medical industry doesn't, one, know what they're talking about, and two, doesn't care. And so with that, I invite you, if you feel like you need my support, I invite you to go to www.kaismithonline.com/consultation so that you can sign up for a 15-minute discovery session with me, so that I can see if you are a candidate for my 3-step process. That's www.kaismithonline.com/consultation. So you guys have a wonderful day, and just know that Kai loves and supports you. And if you need my assistance, you can reach out to me in my inbox, or you can go to kaismithonline.com/consultation and schedule your 15-minute discovery session with me to see how I can assist you personally with building a blueprint to eradicate hair loss.